Everybody, thanks for coming. Thanks for organizing this great conference. The talks have been fantastic. I've learned so much. I've got a bunch of story ideas too for follow-up. So I'm here to talk about the whole problem of fake news and fake accusations, that the real news is fake news, and how journalists are trying to deal with that, respond to it, increase trust, increase the spread of real information, and do whatever we can to compete against misinformation, to improve the signal-to-noise ratio, like all of us are here to try to do better. It's hard to remember, but the term fake news is fairly recent. It isn't something people used to say. There was an analysis by the Committee to Protect Journalists recently looking at Trump's tweets. There are a lot of charts. There's so much data to work with when you look at his tweets. And what this is a color-coded analysis of what sorts of insults he has against the press. And so they used to be, rich and varied and about all kinds of things, usually about specific reporters he would insult. And then right after the election, the red bars are the term fake news. And so he started saying this more often, and now, most days he tweets about how we're the enemy of the people, which that's in yellow. And then a more recent talking point is calling the press the opposition party, and that's probably going to increase as the election gets closer. So that's just the background. That's what people are hearing. And so what do we do about that? How do we fight that? And so what journalists across the board are trying to do more of is show our work, show how we know what we know, why are we telling you this, where did we get the information? And one of the workshops this afternoon is on the Transparency Project at Science News, and they're doing a really good job of this for adults and for younger readers. And then there's been so much science on misinformation, research, academic research, all the sorts of studies we've been hearing about today. So we report on that as a subject of stories, of journalism, to kind of help people understand where's the misinformation coming from, why are they seeing so much of it. And then we use that research to inform our own presentation of facts, and how we do our headlines especially is something that we really think about. How can we use the principles of misinformation research to make sure we're doing it right and not wrong? And then how do these principles apply to coronavirus? Because we've been scrambling to do that right and to do all these things as we cover coronavirus. So to show how we do our work, we simply, one of the things Trump keeps saying is that the news just makes up sources, makes up stories. There's no anonymous sources. So we basically just explain how anonymous sources are. Why do they need to stay anonymous? What's their relationship like? How do we know they're real? We don't just take their word for what they're saying. And then we also, one of the ways that we try to fight misinformation is there's so much bad health misinformation. And so we run a lot of stories trying to expose, especially things that harm people, like stem cell clinics. And in this story, this is another sort of showing our work. We have what we call like a did it section, as in this is how we did it, where we say, we had telephone scripts, internal memos, emails. We talked to doctors, nurses, patient coordinators. This is why, this is who spoke on the record, this is who didn't, this is why. And then we looked at documents, we went back to the company. So basically just saying again and again, we really know this. And it's partly to gain people's trust so they know they can believe what's in the article. And then it's also so we don't get sued, because people like to sue us now that Jeff Bezos owns us. And then another thing we're trying to do is distinguish between news and opinion, and just label, and this is across journalism. You'll see a lot of publications now sticking the word opinion or analysis or first person or perspective at the beginning of a title, especially when it's shared on social media, because it's really hard for people to know the difference and know that the editorial staff has a completely different structure from the news staff, and a lot of times they publish things that I don't think are true or that literally aren't true, but they still publish them because they have a different kind of way of thinking about how they share information. And then we cover a lot of the excellent research that's been done on how fake news spreads, who is spreading it, how quickly it goes, to kind of help readers understand this phenomenon. And then one of the principles that replicates really well, I think, in the misinformation literature is the idea that if you're going to tell somebody that they're wrong or that this belief or this idea is not true, you need to tell them what is true as quickly as you can and as closely as you can to where you debunk the myth. And so this isn't actually my headline, it's another department. But this story did really well, and I think it set that up, that, this fat-burning heart zone thing that a lot of people were buzzing about at the time. You've heard about this. It's not true. We're going to tell you what really does work. And of course, it's pretty simple. There's no secret. You have to exercise and eat less, which is too bad. And then, one of the things about the anti-vaccine movement is as we've talked about a lot today, it tries to project this idea that it's just a grassroots movement and all these people are concerned, and shouldn't you be worried too because all your friends and neighbors are worried. And so there was a nice study showing, tracking the money, following the money. And there's just two groups. This is Robert F. Kennedy Jr., and his group is one. And that's where most of the money comes from. So that's really who's fueling it. And it's partly so people understand that it's not a broadly distributed thing. Still, most people know that vaccines are right. There's just a few bad actors who are really trying to stimulate mistrust. And then, another thing with misinformation is it really helps people know not to trust something if they can be shown why somebody is lying to you. And so we did a big story about Joseph Mercola, and he's lying to you because he can make a ton of money making people think that if they buy his vitamin C supplements that they can protect themselves from measles, and it's much better than getting a vaccine. So showing that motivation kind of helps people question what they're hearing from the anti-vax movement. And so this brings us to coronavirus. This is just a screenshot of the homepage of the Washington Post. And for the past several weeks, we've had what's called a live blog. And that's the thing up in the corner, this live updates. And we keep constantly updating this with, as news comes in from around the world, as the time zones shift, where what's happening in the research, where are the new case counts, what are the new recommendations, and it's been sort of top of people's minds, and we're finding people are really, really interested. People are just constantly paying attention to this, and it's a little bit of a feedback loop because if we put it above the digital fold, it's right there in people's faces if they come to the homepage, and the constant updating makes it get more attention from Google because news is breaking, and so then people pay more attention to it, so it gets more traffic, and so that gets more Google searches too. So it's been this constant loop. It's legitimately a huge news story, but we have to kind of think about when should we say this part's really alarming. This part is just a kind of boring update. And when there's something happening that everybody's paying attention to and there's a lot of confusion about, that's just a perfect situation for misinformation. And so one of the ways to sort of disarm misinformation and help people kind of cope with the lack of information is to say what we do and don't know. And that's often really a very effective method when you're communicating about science. People have a lot of questions. It's just super disarming to say, well, this is something scientists don't know yet. This is something they want to know. Here's a couple ideas, but they're not sure what the answer is. They'll figure it out, or they're hoping to figure it out. And then you can kind of focus on what is known, and people are a little less kind of spun up about the questions they have. Like telling people that there isn't an answer to a question is an answer to the question in some situations. And so we've done about three articles like this, and we're doing them pretty much every week on just updating what's the latest. And the science is moving incredibly fast. So Reuters the other day did a really nice graphic presentation of just the scientific literature on coronavirus. And you can see the COVID-19, you can see this is just the number of papers published. So it's happening really fast. Everybody's trying to get their data out. They're sequencing it. They're testing drug candidates. They're characterizing it, talking about case studies or clusters. And what's nice is that a lot of the journals have dropped their paywalls for these. It's just everybody's really, really working hard and working fast and trying to share information and being very generous with their information. But what that means is there's a lot of stuff that gets out that turns out to not be true in this rush to share. And so in this graphic, the yellow pages are the papers that aren't peer-reviewed. The white ones are. And then some of the black marked through ones are papers that have been withdrawn. So there's just, it's hard to sort out what's real and what's not legitimately without any bad actors. And this is another chart from that same analysis looking at the x-axis is number of tweets, the y-axis is news article links. So, I like to think the news article links are more legit than the tweets, who knows? And the one outlier is a paper suggesting that the virus was related to HIV, which it wasn't. I think, as far as I can tell, it was a legit just error. But that kind of, surprising news spreads really fast on social media, even though it's been retracted. And so, as part of our coverage, we've published, I imagine, at least 1,000 articles by now, if you include the blog posts. We tried to, a lot of publications are trying to equip people to recognize what the misinformation is and how it's spreading and why. So we cover that. And BuzzFeed News had a really, really nice list. They did a great job. They were some of the first to jump on the list of the disinformation and where did it come from and how do we know it's false, and just made it really simple for people to see. If this is coming around in your Facebook feed, this is why we know it's not true, and it's not true. And here's why. So this kind of equips readers to quickly tamp down their social media connections and share real information, which I love the study earlier today showing that can be really effective, not just for the person who shared it, and maybe not for the person who shared it originally, but for everybody who's watching the correction of their acquaintances. And they do, so in one of them we've talked about before, there's all these miracle cure claims, a lot of it from the anti-vaccine movement. There never was a situation so bad that somebody from the anti-vaccine movement couldn't show up and make it a lot worse. So this is from BuzzFeed's list, and they put a red X through the false things, which is just a nice visual cue of, yeah, this looks like it's legitimate, it looks like there's evidence, but it's completely wrong. The problem is, reality is really just as bizarre as the stuff that's made up. This is true. The South Korea spike, more than 2/3, and I think now it's 3/4 of the cases in South Korea are linked to a religious sect, which is a newspaper way of saying cult, that the leader decodes the Bible to find messages of an impending apocalypse, which just is so cinematic, but it's also true. So it's hard for readers to know what's legit and what's not. So we try to, when there is something like this that's just so bizarre, but also true, then we certainly cover it. And then I mentioned headlines. It took journalists a while to realize that you have to debunk the myth in the headline. You can't just say, politician X said YZ. You have to say politician X falsely claimed YZ. Otherwise, you're just passing along this thing that was said. It's true, it was said, it's just a thing that's not true. So we're trying constantly to say debunk, fringe, conspiracy theory. It doesn't always work. U.S. Senator Tom Cotton repeated the myth that was in the last slide, that the coronavirus was part of a biosecurity lab and was a weapon that was released. So he repeated that. And so instead of just saying Tom Cotton says that the coronavirus was made in a secret lab in China, we say, he's repeating it, it's a conspiracy theory, it's already debunked, to just tamp it down immediately. So that's what we are doing, but I think, as everybody's said here, it's really the platforms. The more they can do, the better, because that's where it's spreading. The mainstream media, for the most part, aside from some of the main coverage of the anti-vaccine bills, sometimes you get clusters of bad local reporting, but for the most part, where it's really going bananas is on the platform. So if we can all find better ways to do what we can as individuals to fight misinformation, but it's really going to be algorithm solutions for a lot of this. Thank you.